ladies and gentlemen. First of all, I would like to thank the SICOT Congress and the organizers for allowing me to present this paper and to evaluate as one of the best papers in the Congress. Isolated tears of the subscapularis tendon are uncommon, and the largest series in the literature is one of Laurent Novy-Josserand with 21 cases. The purpose of our study was to report the results of repair of isolated lesions of the subscapularis in a large series of patients. It was a retrospective review with 84 shoulders with a minimum of 2-year follow-up period. The indication for the repair was traumatic tears in young motivated patients and degenerative tears failing non-operative treatment in motivated patients. On the video you can see an excessive passive external rotation of the right-hand side for a patient suggested a subscapularis tear. Most of the patients were male, dominant-sided, and the mean age was 53 years, and most of the tear was traumatic. All the patients had the pre- and postoperative fluoroscopic controlled radiographs, and in 86% of the cases CT arthrography was performed as well. The fatty infiltration of the subscapularis muscle was classified by the Goutelier classification, and for the purpose of data analysis in this series the stage 1 and 0 was considered together as a minimal or mild fatty infiltration, and stage 3 and 4 were considered together as severe fatty infiltration. During the surgery, the subscapularis was torn in the superior third in 27, superior two-third in 49% of the shoulders, and there was a complete tear in 24%. The long head of the biceps was classified during the surgery as normal, ruptured, or subluxated, dislocated. All patients underwent an open subscapularis repair, and in most of the patients had a concomitant biceps surgery, biceps tenodesis or tenotomy. The patients were evaluated by the constant score, lift-off test, belly press test, and subjective results. On the upper video you can see a good internal rotation strength with a good subscapularis, and in the with the right hand the patient had a subscapularis tear in the positive belly press test. Significant improvement occurred in all components with the follow-up, with the latest follow-up period in regard of constant score. 90% of the patients were subjectively satisfied, excellent or good results, and most lift-off test positivity and belly press test positivity decreased significantly after the surgery. In the upper video, it's a good subscapularis function with negative lift-off test, and the other hand, right hand, you have a subscapularis tear with a lift-off test for the same patient. We had some complications. 5 re-rupture were confirmed by arthro-CT, and 3 other re-rupture were suspected by the means of excessive passive external rotation. There were 3 hardware migration, 4 stiffness, 2 nerve palsy, 1 infection, and 1 biceps tenodesis failure. We analyzed the factors which can influence the constant score, and we found that the age at the time of surgery was the most important factor in regard of constant score, and the longer delay to the surgery had a negative influence as well. To perform a biceps surgery, tenotomy or tenodesis had a good influence, a positive influence on the constant score, pain score, activity score, and subjective results as well. And to perform a biceps surgery and these beneficial results was completely independent of the preoperative condition of the biceps. The belly press test positivity, postoperative positivity, was mainly influenced by the fatty infiltration and the larger tear size. We analyzed the lift-off test positivity as well, and it was mainly influenced by the fatty infiltration, and the longer delay to surgery and not perform a biceps surgery had a negative influence on the lift-off test positivity because of the remnant of the pain of the patients. Results of subscapularis repair are acceptable in most cases, and the treatment of biceps tendon has significant influence over the constant score and the subjective outcomes, and it's independent of the biceps preoperative conditions. Re-rupture did not seem to influence the constant score or patient satisfaction. Postoperative subscapularis function, as belly press test, lift-off test positivity, most closely related to fat infiltration of the subscapularis muscle. Subscapularis function strength did not seem to influence the constant score, as the constant score analyzed mainly the strength of the deltoid and supraspinatus muscle and tendon. Thank you very much for your attention.